Right, got it. Hello, hello, everybody. Happy Monday. So good to see you all in your faces for face yoga. So excited to have you joining us. I'm going to give you all just a minute to get connected. Hopefully you'll be willing to keep your screens up so that we can all practice this together. We're very excited to have this therapy break today and not only learn a bit about, but also practice face yoga. And I would love it if you would open up your chat box, and that's where you can ask your questions, and we will save some time at the end for questions. But we're very interested in, your interest in face yoga. I know that we had quite a few people register, and I'm so excited about that. And I was wondering, what drew you to this particular program? So we love knowing what is of interest to people. So we would love to hear your interest in face yoga. You're going to learn about face yoga today and why it's beneficial for Parkinson's. And we'll make sure that we share the website where you can get some additional information. So for those of you who may not know me, my name is Anissa Mitchell and I'm with PMD Alliance. And I am excited to introduce to you today Theresa Conroy, who is joining us. She is a certified yoga therapist, an online yoga instructor, and owner of Theresa Conroy Yoga Therapy. She specializes offering yoga therapy practice to small group classes, private sessions. She earned her certification as a yoga therapist from Phoenix Rising Yoga Therapy and Inner Peace Yoga Therapy. She's certified in yoga for chronic pain, curvy yoga, core strength vinyasa yoga, and is trained in adaptive yoga for disabilities, and the creator of and teacher of yoga for PD and teaching yoga for special populations, training for yoga teachers. So she's quite the expert in yoga and various forms of yoga. So I'm very happy to introduce Theresa. Thanks for joining us, Theresa.
Thank you, Anissa, so much, and welcome everybody. I'm so glad to have such a crowd, and I see your faces for face yoga, which is terrific. I want to just start by saying, let me know if at any time you can't hear me or can't see me, and I'll tell you the best way to get my attention, and I'm going to demonstrate, is to put your hand up to cover your camera. Now, I can't see everybody's screen, so you're welcome to chat as well, and that, because we have quite a few screens, so that's always a good way if somebody wants to let me know. I see some of you testing that out. I want to let you know that I am a certified yoga therapist, and that means that I've received or I've taken, as you heard, I went through 2 yoga therapy programs. I have a lot more education and training and experience than your traditional yoga teacher. And it was always my intention to become a yoga therapist when I left my old job as a newspaper reporter in Philadelphia. But it wasn't my intention to specialize in PD. And that happened, just came my way. I had a client who actually is the husband of a source of mine when I was a reporter who was diagnosed, and I thought, I think yoga might be able to help him. And I started to see him when I was still working I used to work at the Philadelphia Daily News. And when he went back for a checkup with his neurologist, the neurologist said, "What have you been doing? I see some changes." And he said, "Well, I do yoga with this woman." And from that moment on, I started to get actual prescription pad. People showed me on the prescription from a neurologist at the Thomas Jefferson University Hospital here in Philadelphia to take yoga. And from this neurologist. And that got me started on what I consider the joy of my teaching. It's the best part of my teaching. One of the reasons it is because you can see almost immediate results with folks. You can actually see posture change and see muscles loosening. So anyway, that's why I chose to do this. And face yoga is part of what I teach. I've been teaching for Parkinson's for about 16 years now. And face yoga is one of the things I do for a number of reasons. I want to tell you some of the benefits that I see from what I'm using as a catchphrase, face yoga, is first of all, when I work with folks, I always kind of prioritize their symptoms. I like to ask, because symptoms are so different with everyone with Parkinson's. I like to prioritize what, if they tell me I have a really bad, my balance is really bad, I'm falling all the time, that one goes right up to the top. And another thing that goes right up to the top for me is when someone tells me they have trouble swallowing. So some of the work that I do involves using those muscles that we use to swallow. And I hope you'll feel that and experience that. And also for projection of your voice. Now that's not a real dangerous one, but it could be annoying for you if folks pretty much tell you all the time, I can't hear you, ask you to repeat yourself. So part of what I do with face yoga is voice projection, and some of that, a lot of that comes from the breath, which we'll touch on today too. And then the other part that has an impact here is something, and I struggle because I've been trying for a long time to think of a way, a better name for what is commonly called the mask of PD. And I just don't like that because it's not a mask. I don't like putting that mask on someone's face. But you might know, you might have these symptoms where you kind of lack a little expression, or your face is not as expressionful as it used to be. And part of what face yoga can do is, you know, we're kind of a two-way street between our brain and our body, and the nerves, the cranial nerves that move our tongue and our face and open our eyes and things like that and help us taste. Those things are, you know, those messages are going from brain to the part of the body, but also the other way. So sensory neurons from your face, from your tongue, are informing your brain. So I kind of want to get that flow of information both ways, and I want you to use your face and feel your face and move your face. So part of face yoga is that. You might have heard of the, you know, fame that face yoga has gained among some of our celebrity types as being a way of making you look younger. And not really, but part of what we're going to do is work on relaxing some of the common muscles that get tight, like your jaw, around your eyes, your forehead. And once you relax your face a little more, you might notice that some of those lines disappear, or they become smaller or less visible. So in a way, it makes you better looking. The other thing we're going to do is, I think of as a way of dealing with a lot of stress and tension around the eyes. And we're going to focus on our eyes. And that's not going to improve your vision, but it's going to maybe help you release some of the tension that you might feel. We're all staring at screens way more than we used to. And I always tell people, if you're working in a computer or looking at your phone, every, 15 or 20 minutes, look up from your screen. And if you're lucky enough to be at a window and be able to see some nature, look up at the furthest, highest tree you can see and look at it for maybe 20 seconds. So you think every 20 minutes, look at it for 20 seconds. Because when we're working up close, the muscles in our eyes stay the same to focus at close-up work. And when we change what we're looking at, that changes as well. And it gives those muscles a break. So we're going to do a little bit of work on our eyes. I want to say, before we get started in any of this, that there are two questions I ask people to ask themselves when they're practicing yoga. The first one is this safe? And the second one is, will I pay for it later? So is this safe notice I'm not saying, does this hurt or is this uncomfortable? Because those things are not always, stay away from, depending on the circumstances. But if anything that we do today makes you feel unsafe, stop. And included in that, we have quite a number of people here today, and I would bet that I'm not alone in being a sufferer, at least occasionally, of vertigo. And if you have vertigo, number one, if you don't know the cause of your vertigo, then you should limit any serious head movement today. My cause of my vertigo is a problem I have with one of my eyes. So I modify that when I do eye work. If you have glaucoma, then we're not going to let our heads go far down and have pressure on the eyes. But if anything else makes you feel unsafe, don't do it. Or if you think, this neck movement's great, but it's probably going to bother me tomorrow, stop. So those are my words of wisdom for that. I also like to, and this could go for any exercise you do, if something comes up and something bothers you, feels uncomfortable or painful, stop what you're doing and see if the sensation goes away. If it goes away, you might be able to continue. If it doesn't, you want to stop completely. So that's just my little, warning, I would say, before we get started. So because we are doing yoga, and because yoga is so intimately involved with breath, this is where we're going to start. So I'd invite you to keep your eyes open and on the screen, to close your eyes, or to even have a soft gaze down, whatever works for you, because I'd like you to draw your awareness inward a bit to feeling and sensing your body. This is another way that yoga is really powerful for working with movement disorders, the ability to strengthen our brain-body connection. So feeling maybe the bottoms of your feet right now, noticing the feet touching the floor, feeling your bottom touching the chair, noticing the parts of your body that move as you breathe in and the parts that move as you breathe out. Just noticing that. And then focusing a little bit more on your breath, letting the breath come in and out slowly through your nose. And I'm not going to get technical about how to breathe. I don't like to do that. All I'm going to ask you to do is breathe a little more slowly, a little more deeply, and in a more relaxed fashion than you usually breathe. That's all. Deeper, slower, more relaxed breath. We consider the breath, among its many benefits, not the least of which is keeping us alive, we consider it to be the bridge between brain and body in yoga. And then notice how the breath feels in and around your face. Notice sensation of air that might come into the nostrils. Notice the temperature. Notice any sensation in the sinuses. Notice how your face responds to or participates in breath. And this, the noticing, the awareness, is mindfulness. So I'd invite you throughout this class to be mindful of the sensations that come up. Notice temperature of the air, movement of the mouth, how it feels to swallow, how it feels to move your eyeballs. And then let's just start, since we're going to be working on our face, let's just start really connecting to sensations in the face. So bring your awareness to your forehead. Now, you might feel something and you might not. It's hard to feel your earlobe. So just notice what's there. Oh, I can feel tension, or I'm not feeling very much at all. Just connect. Just notice. Notice the skin around your eyes. What do you feel there? Notice the nostrils and the air. Feel the outside of your left cheek and then the outside of your right cheek. Without even touching, feel the bridge of your nose. Just feel it kind of internally without touching it at all. Upper lip, lower lip, the jawline. Now, feel the inside of the mouth, the fleshy inside of your left cheek, fleshy inside of the right cheek. Have an awareness of teeth and gums, tongue. Notice any tension that might be present in your face, and let's move down now to the neck. Notice sensations in the neck. We really can't isolate so much. Bring in the neck into this a little bit. Notice the neck. And we're actually going to start our movement with the neck. So sitting up tall, letting your shoulders relax, you're going to drop your left ear until it hangs over your left shoulder. And notice that there's sensation. Notice that it brings attention and awareness to how your neck connects to your torso and how it connects to your head and face. Now notice how intense this stretch is for you. Now bring your head to center and then tip your ear over to the other side. Now notice, does this one feel tighter or looser? Try to gather some information that might help you. If it's tighter, that might be because you tilt your head in one direction. Now bring the head back up to center, and you're going to swivel your head to look over the left shoulder, just as far as you can without pushing, and then bring the head back and look over the other shoulder. Now come back to center, release your chin to your chest, and let the back of the neck lengthen. Notice that space where your skull kind of meets your neck, that occipital ridge. Imagine, if you could, that the little hairs on the back of your head are standing at attention there. That's how much you're stretching right at that point. And then we're going to bring the head back up. Lift your chin just enough so that you could gaze, if you have your eyes open, right at the top of the wall, but not overhead. And then bring your head back to center. Now, I want you to notice the forward and back position of your head. So without changing the chin level according to the floor, I want you to bring your head forward and then bring your head back as though you're trying to create a double chin. And then slowly bring it forward and bring it back. So now we're going to bring it forward and just pause here for a moment. I don't want to stay here too long because you know why? I bet you spend a lot of your day in this position, looking at a computer, looking at a phone. And we can carry that posture with us when we get up to do whatever else. That forward head position, the weight of your head now is making your neck muscles work extra hard because you're not aligned with your skeleton as it's designed to hold your body. So let's take the head back, not terribly far back, to the point where it kind of closes off your throat, but find a position where your head feels more like it could float. There's not a lot of muscular work to hold it up. Try to make sure your chin is level with the floor and not popping up or dropping down. And if some of this seems like a mystery to you, try doing it in a mirror sometime, just so you can see how you're holding your head. Now relax the shoulders. Imagine a string pulling up through the crown of your head, so neck is getting really long. And then we're starting with this foundation of a relaxed neck, head, and shoulders. Now I want you to bring attention to your mouth. The first thing we're going to do is take the tongue and you're going to push it hard into the inside of your left cheek. And just hold it there. So you're going to start to feel muscles in the throat and in the face. The kind of feeling of muscles that you would swallow with. Now release and let your tongue press into the opposite side. Now let it go. Go back to the first side. And then back to second side. Good. Now relax the tongue. And I want you to take the tongue and trace over your teeth, top and bottom teeth, kind of like you just ate something delicious and you want to get all the traces off your teeth. Go around in the same direction. Really get a big circle as far as you can and start to feel what's happening in the neck, in the face. Now, let that circle go in the opposite direction. Notice, does this feel different? Is it harder to do? And now, stop and relax your tongue. And now, swallow. Feel the swallow. Notice if any tension's been created in your jaw or your cheeks. Relax, because that was a lot of muscular work. You wouldn't think that, would you? But they could have an Olympic event of that, I think. You'd have to train for it for many years. Now I want you to notice your jaw. We're going to talk a little bit about jaw tension, maybe tension that might prevent opening, or tightness in the face and jaw, and get things moving a little bit. But let's take like pre-flight check here. Let's see where we are right now. So the first thing, open your mouth as wide as you can. And just notice. Yeah, and a lot of you are doing exactly what I do. I can't open my mouth without starting to yawn. And then once I see somebody else yawn, I have to yawn. Very catchy. Go ahead and relax your mouth. Now, we're going to take the bottom jaw and move it left to right. Notice how much movement's there. Notice if you hear any sounds. Good. And now relax. Now I'm going to ask you to do something that I have to explain to you before you do it, because you're going to have your ears plugged up to do it. What I'm going to ask you to do, and don't do it yet, is bring your fingers, you have these little nubbins, I call them, right in the ear, right? We're going to bring our fingers there and we're going to close our ears off. Don't do it yet. Don't do it yet. You're going to close your ears off, and then I want you to move your jaw around again and see what you hear and feel. And then you're just going to stop and come back. Go ahead and close your ears. And then go ahead and bring your hands down. Maybe noticing some cracks and pops, hearing it. Ooh. Now, I want you to take your hands, the top of your ear, take fingers to the top of each side of your ear, and then drag it down just a little bit. You'll feel like an indentation and then a broadening. Stay right at that broadening. Now open and close your mouth again. Right up there by the top of your ears, can you feel the movement of your joint, your temporomandibular joint? Boy, I wish that was down a little bit lower. A lot of us have it up really high because we're tense. Now, press in, maybe with 2 fingers, 3 fingers, whatever you can manage. Press into that area a little bit and make little circles. A little bit of pressure, not too much, but nothing faint. You want to get beyond the skin. And then press down and traction with your fingers as though you're trying to pull that jammed jaw down into release. You might even move your jaw a little bit. And then relax. I just briefly show you that one of the things, and I have this right by my side because I use it often, but if you have tension in your jaw, you might get one of these hard balls and just run it over your face into the muscles might be very helpful. So now we did a little bit of checking as to what our status is right now. What I'm going to have you do is take your left hand and bring it to the left side of your jaw. And you know that movement, what we did back and forth, I want you to press your jaw into your hand, not up here by the cheek. We're going down to the lower jaw. Press your jaw into your hand and let your hand resist that. Just a little, like 25% of your effort. Just let it resist. Take a few long breaths. Good, and then let go. Now go to the second side. Same thing. You're pressing in gently. You're not trying to whack yourself. You're pressing in gently and resisting. At the same time, you're breathing. Let's go back, first side. Press in, resist. Next side, press in and resist. Good, and then let go. Now, move your jaw again from side to side and notice if it feels a little bit looser. Mine felt a little bit looser. I'm going to ask you to take your hand, or sometimes I like to use a little bit of a fist here, under your chin. You're going to let your mouth try to open, and you're going to let your hand is going to resist that. So press into your hand and resist. And hold. You're breathing and trying to relax the rest of your body. Don't tighten up the shoulders. Relax the back. Let the tongue just float in the mouth. You're just pressing. Now release and pause. And then we'll do it again. Try again. Good. And relax. Now, we're going to open the mouth, and you're going to try to close the mouth with the hand, but let the mouth resist. Same thing, but different movement. Trying to close that mouth, but resisting it. And then relax. Take a moment. And then we'll do it one more time. Good. Now relax. Now open your mouth as wide as you can. See if it feels looser. Maybe move the jaw around. And now one that combines the jaw release with what we were doing before with the tongue. Open your mouth and stick your tongue out as far as you can. We're going to come back to that in a bit. I want to move a little bit because we're right up here, we're down here before we move up to the eyes. I want to stay down here, and I want to stay a little bit in with the throat or with sound. And it's really not quite accurate for me to be talking about the throat because I want the sound to be projected from deeper than that. I want you to think about your breathing diaphragm. So consider when you have a little muscle between each rib. You know, when you inhale, those muscles cause the ribs to expand, you know, in all directions, 360, moving out, essentially. When you exhale, the same muscle changes its function, and it now lets the top rib move away from the bottom rib, and so on and so on. It lengthens the rib cage, and it lengthens the rib cage so that the breathing muscle, the domed diaphragm, can move up and help to push out the air. So by toning the diaphragm, we help to increase sound and projection. And this I learned from really interesting source. There's a body modality called Alexander technique. and it was developed for singers and actors. And I learned this breathing and technique and projection technique from a woman who's worked in Broadway, and she's an Alexander Technique practitioner. And I specifically studied this so that I could help people with Parkinson's project their voice. And I really like this. And what she illustrated to me, we're going to do some exhales where we're going to count out loud. And what she illustrated is the difference between, I'm going to demonstrate. I'm going to imagine, and I have my hands on my rib cage, I like to imagine those ribs coming down and kind of iron it down. And as I exhale, I'm going to let the inhale be natural. As I exhale, I'm going to count. So I'm going to demonstrate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now notice the difference between that and this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That came from my throat. The other came from deeper. So you can even put your hands on your rib cage if you want, or let your hands relax. We're going to take an inhale breath, and you're going to count out loud from the diaphragm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's try again, breathing in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You'll feel abdominal muscles engaging too. Let's see if we can gradually begin to count a little more. Breathing in. Exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3. Do the best you can. Inhale. Exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. One more time. Breathing in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4. And now relax. And I want you to just let your natural breath come in, because you can feel sometimes a little loopy after doing all that in your head. So just a few deep breaths. So a way of projecting the voice. Now, we're going to do, before we leave the throat, we're going to do 2 other little voice parts of face yoga. One of them is going to be a pose that we call lion's pose. And we've already done it, but without the sound. And the other one is going to be chanting Om. So if you don't feel comfortable chanting Om, you could just say ah or yay, whatever. It's just, I want a sustained movement, a sustained sound. So the same thing, we're going to breathe in. Part of that sound, Om, A-U-M really spelled, or we think of it as O-M, is the M. And when we come to the M, that's why you might say, I am. You can say M instead of Om if you don't like that. But let the vibration be in your throat when you do it. Let's try it one more time. Really project. And then relax, take a few breaths. Next one's a little more fun, a little goofier. So if you have people in the house don't know what you're doing, they might be surprised. We're going to do that movement we did, opening our mouth, sticking our tongue out, but this time we're going to roar like a lion. This is lion's pose. I'll show you. Ah! Right? But really gets you going, really moves that throat chakra. Let's try it together. Inhale. Ah! And go ahead, try one more time. I have to take water because it tickles my throat. And then we're going to stop. I don't know if the rest of you felt that, but it gets into my throat. Now we are going to leave the throat, jaw area, and we're going to go up to my favorite part, the eyes. So take a moment here. Just let's close our eyes for a moment. And just notice the sensations of your forehead, around the eyes. Notice if it feels soft and relaxed or tense. And then go ahead and open your eyes. And I want you to keep your head completely still. You're only going to move your eyes. You're going to move your eyes as far as you can to the left without moving your head, and back to center, and as far as you can to the right. Then over to the left, don't move your head. Over to the right. Back to center. Without moving your head, look up. Feel those eye muscles, wow. Come through center, look down, but don't dip your chin down. Back to center, look up. And then down. Come back to the center. Look as far as you can to the upper left corner, lower right corner. Upper left, lower right. Keep the head still, back to center. Upper right, lower left. Upper right, lower left. Now relax. Take your hands and rub them together. Rub, rub, rub. Get as much heat as you can in your palms. Now, cup your hands over your eyes. Don't press into the eyes. Just cup your hands over the eyes. Relax the eyes. This is a nice little yoga technique. It's a nice thing to do when you have a headache too, like a muscle tension headache. Go ahead and drop your hands. Now we're going to take our finger, our thumb in front. And to begin with, moving, oh, you're not going to move your finger. You're going to stay focused on your thumbnail and move your head from side to side. And this is one of those places where if this doesn't feel safe, stop. Like if you think, oh, that's going to trigger vertigo, just stop. Come back to center, and then keeping the thumb still, look up and look down. Move your head up and down, but stay focused on the thumbnail. Good. Now relax your arm. Close your eyes for a moment. Just let the muscles relax around your eyes. Now let your eyes open. And this time we're going to keep the head still and move the thumb. So right to left, following that thumbnail, focusing. You can switch arms in the middle if you need to. And then coming back to center and up and down, letting the eyes track. I bet you are familiar with this movement, maybe from your neurologist's office. Good. Now, you're going to bring that nail out. Well, let's bring the thumbnail maybe about 6 or 8 inches from your face, maybe 10 inches. Stare at your thumbnail. And then look up at something farther away at you in the room or out the window. And then back at the thumbnail. And then look up and away. This is what I'm talking about, refocusing. Back at the thumbnail. Up and away. Come back at the thumbnail, take it far away, and then keep looking at the thumbnail as it comes forward. You're going to probably see double vision. And then move it far away. And then come back. And move it far away. And then relax your arm. Let's create some heat in the hands again. Rub, rub, rub. And then gently cup your hands over your eyes. Let the eyes relax. Close the eyes. And then release your hands. And we're going to lift the eyebrows up as far as you can. Feel that tension and tightness. And then let it completely relax. Sometimes, I like this practice because sometimes we can't tell how tense we are until we tense even more. Bring the eyebrows up. And then relax. Now, squeeze your eyes closed. And then relax. Squeeze your eyes closed, squinting, tightening, and then let go. Now open your eyes. Just notice your room or look into your camera. Look away, look around. And now we're going to move into another part of our practice, which is our meditation slash relaxation. And we're going to begin by focusing where we left off with our face. And this is a process that it's a part of a practice called Yoga Nidra. It's Nidra. And Nidra in Sanskrit means sleep. And so it's a yoga sleep practice. It's really a deep guided meditation. But by the way, if you have sleep issues, I will put the name of this in the chat, and you can search it. You can get one of those apps that you meditate with, like Insight Timer or Calm, or even look it up on YouTube. And it's a wonderful practice to help you go to sleep at night, but it's also wonderful just at any time, really rejuvenating. And part of the practice is what we call a rotation of consciousness, where I lead you, I guide you to pay attention to and notice different parts of your body. And I'll explain this more as we start. We're going to do a short bit of it. One of the reasons I've been using this practice for a very long time, you might notice a little bit of similarity when we started, just noticing how we feel in different parts of our body. This is only anecdotal in terms of what I think its value is for me, I've noticed very significant ability for people when they practice this consistently to improve their proprioception, their feeling of where their body is in space, and to improve that brain-body connection, which helps with movement, kind of helps to fill in some of the gaps left by neurological movement disorder. So I use this all the time, and I highly, highly recommend it. There have been some small studies on Yoga Nidra, and I know that in one, they found an increase in the production of dopamine. So that's beneficial as well. So we're going to do the part of Yoga Nidra called rotation of consciousness for that reason. It's also pretty relaxing. So I encourage you to now sit in a really comfortable position. You are welcome if you want to go to a more comfy chair. I don't have to see you for this. If you want to sit somewhere else or lie on the bed or the floor, just take a moment to find a comfortable way of being. We're only going to do it for about, 10 minutes or so, maybe less. So find a comfy way of sitting or being. And when you get somewhere where it feels comfortable, you can close your eyes if you'd like, if that feels safe, that feels good. And then for this rotation of consciousness, all you need to do is follow my voice. I'm going to name a part of your body. And I'm not going to ask you, I don't want you to touch the part of the body or even look at it. I'd like you to feel it, try to connect with it, maybe even picture it. And see if you notice any sensation or lack of sensation. Noticing a lack of sensation is also noticing. And then we're going to move on. Just follow my voice as I move on to the next part. Because the work we've been doing today, I'm going to start this exploration inside your mouth. So feel the tongue. Notice the inside of the left cheek, the inside of the right cheek. Roof of the mouth, floor of the mouth, upper lip, lower lip, left cheek, right cheek, the front of the neck, the hollow notch at the base of the throat, right shoulder joint, right upper arm, elbow, forearm, right wrist, right hand thumb, index finger, middle finger, ring finger, pinky finger, the hollow notch at the base of the throat, left shoulder, left upper arm, elbow, forearm, wrist, left hand thumb, index finger, middle finger, ring finger, pinky finger. Both shoulders, arms, and hands. Notice both shoulders, arms, and hands. Return to that hollow notch at the base of the throat. Notice collarbone, chest, navel center, lower abdomen, right hip joint, the front of the right thigh, right kneecap, shin, ankle, top of the right foot, the toes, sole of the foot, back of the heel, right calf, back of the knee, back of the thigh, right buttock, lower back, mid-back, upper back, lower abdomen, left hip, front of the left thigh, left kneecap, shin, ankle, top of the foot, all of the toes, sole of the left foot, back of the left heel, calf, back of the knee, back of the thigh, left buttock, both hips, legs, and feet. Notice the whole front of the body, just the front. Feel the front. Now notice the back of the body and compare it to the front. Does one side feel tighter, stronger, more open, relaxed, heavier? Now feel the whole left side of the body, left limbs, left side of the trunk, even the left side of the head. Now feel the right side and compare. Which side feels stronger? Which side moves more? Which side is quiet? Which side is loud? Now feel the whole body. Notice your whole body. Feel the whole body, whatever the position. Feel the support beneath you. Feel your body support it. Feel your body at rest. Take just a few breaths as you rest. Rest body, rest mind. Let go of thinking, just feeling. Now take a long, deep breath in through your nose. Big, long breath. Open your mouth and let it out. Start to move in small ways, maybe wiggling your fingers, moving your toes, rolling your shoulders around. And as you feel ready, slowly let your eyes blink open, take the light back in, look around the room, notice the sounds. Feel your feet on the floor. That's my favorite part. So that's it. That concludes our face yoga practice. I hope you enjoyed it. And I'm here for some time welcoming your questions. I'm not sure, haven't looked at the chat. Maybe there's some in here.
There was one in particular that came in earlier that wanted to know if insurance covered this. And unfortunately, I think the typical answer is no,
Yeah,
unless
yeah, at this point, no. I'm a member of an organization called the International Association of Yoga Therapists, which is a governing body for us and accredits schools and certifies yoga therapists. And we are actually working toward that. I don't know when that's going to happen. Um, but some of us, I, for instance, receive a grant from the Parkinson Council to teach a group class, which I do virtually now. I do it on Tuesdays and Thursday mornings and by Zoom. And that is lower priced than you might get some yoga classes just because I have that support. So there are some people doing this work who do get some kind of support or grant, and it might make it more affordable. And it's certainly more affordable to practice in a group setting than to do individual or private work, which I also do with people. So it might at some point. And by the way, some of my colleagues who work, there are some people who work in like physical therapist's office. There are also some physical therapists who are now becoming yoga therapists as well. And if that's the case, then yoga therapy would be covered because they would probably be able to use the code for physical therapy. But, not always. So that was a good question.
yeah, they want to know if this has ever been paired with speech therapy. It feels like it would be helpful, kind of a natural combo.
Yeah, I don't know whether, I mean, I also know, in fact, I myself trained recently a speech therapist who was studying to become a yoga therapist. Other therapists in licensed professions are really, a lot of them are becoming yoga therapists. I mean, not a lot of them, but more and more are becoming yoga therapists, physical therapists, occupational therapists, speech therapists. And they are aware naturally. One of the reasons they do that is because they were practicing yoga and they, like me, said, hey, wait a minute, there's some of this stuff that I think can be applied and helpful to people. And you're right, I think it is really would meld well with speech therapy. I also have to say that when I began learning how to teach yoga for Parkinson's, there were no trainings like the ones I offer for teachers and therapists now. So what I did was I had met some physical therapists who worked with PD. I started to go to all the lectures and things, and I met people, and I just shadowed the physical and occupational therapists to learn what they were doing. And so part of what I do actually is borrowed from some of that work. So speech therapists do that kind of work as well. And I just would think to myself, well, where in my yoga toolbox does this connect? And I would find the yoga pieces for it.
Can you explain a little bit about the difference between a yoga therapist versus just a yoga teacher?
Yeah, a yoga teacher spends 200 hours studying yoga poses and breathing and yoga practices and learns how to basically teach a general, what I would call a traditional yoga class. And yoga therapy basically trains people to take the practices of yoga and apply it to certain conditions, illnesses, situations. So I work with Parkinson's and other neurological disorders. Some people focus on scoliosis, osteoporosis, anxiety, depression. So for instance, each of my yoga therapy schools was probably between like 800 and 1,000 hours between education and practical work, practice work. So I went to two of those schools. So there you go. I have close to probably about 1,800 hours in addition to that 200 hours of training. And it's specific to, for instance, I'm on faculty of a yoga therapy school where I teach yoga for neurological disorders. So those people learn specifically, and I have my own yoga teacher training for yoga for Parkinson's. So they learn specifically how to work with clients, what they need to know about the disease, and also how to apply the practice well. And the other thing too is that even if you were to come to my group class, even a group class online, because I'm a yoga therapist, I'm required to do an intake and assessment. So even if you're not a private client, I would meet with you for 20 or 30 minutes to find out more about you, to assess you, so that when you come into my class, because it's a specific class, I can almost offer some kind of, um, like individual guidance, I would say. So those are the basic differences, I think.
And I can just say, after experiencing just the brief opportunity of going through some of these exercises with you, how much tension I had in my jaw and just in general my face, and how good that felt. Just,
Yeah.
those very strategic exercises.
Yeah, sometimes we don't know that we're tense until we feel either more tension or the release of tension, because chronic tension is just that. It's your way of being. You don't know. I saw somebody flash, where am I located? In Philadelphia, Pennsylvania. But I do teach virtually now. I had a yoga therapy studio that I had to close because of COVID, but I'm actually finding a real upside to working on Zoom, which is it's so much easier for some of my clients to make it to class, because they don't have to get someone to drive them, or drive, or navigate all of that. So um,
So anybody anywhere can actually join in right now and benefit from it.
that's right.
So
That's right.
and I imagine, you mentioned moving away from the terminology of facial masking. Somebody wrote granite face or something like that, which I thought was a really good way of putting it. But, just you get not only everyday tension, but just that rigidity you get. So I can imagine that doing this on an ongoing basis could be very beneficial.
Yeah, yeah, absolutely. And one of the things I advise people all the time is that you don't have to do 45 minutes, a half hour, an hour of yoga every day. I think it's more beneficial if you find some practices that really work for you and you sprinkle them throughout your day. I have a friend who calls it yoga snacks, because you know how it is. If you do a bunch of stretching in the morning, and then maybe a couple hours later, you might feel rigid or tight again. So if you kind of drop this in throughout your day, I'm talking about, and this is the kind of stuff I do, waiting for the kettle to boil. You put your hands on the counter, and you step back, and you do kind of like a downward facing dog and stretch your back out. When you find these things, you should just, and part of what we do in yoga therapy is, I love having people come to class, and people like the community of it as well, and learning new things. But my goal is to teach people to do things on their own, so that they can do it every day. Because if this felt good for you to do whatever we did, 45, 50 minutes or whatever we did of yoga today, imagine what it would feel like to do it every single day, and imagine the impact it would have. And aside from the fact that yoga, I think, is great, yoga is also part of a exercise system. And we know that the benefit of exercise for balance, flexibility, strength, but also don't forget that exercise does something really crucial for us. It helps to protect the brain, our brains, and the neurons in our brains. It protects them from degeneration. So we all need that, and you certainly want it if you have a disease that's causing problems with neurons in your brain. So anyway.
All right, so we've had several questions about your website, which we put in here a couple times. I will recopy it again. I did find a website on yoganidranetwork.org. I don't know if you have any others that you would recommend. People are wanting to know about the Yoga Nidra they could find
Yeah,
online.
they could. Yeah, and I'm just going to type that in Yoga Nidra. You can find it. I typed it in there. And you can find it anywhere. Really, do a search. It's terrific. It needs to be guided, so you would have to, like, put something on and follow it. Um, yeah, no, and it's wonderful for sleep. And in fact, if you search yoga nidra for sleep, some of them don't end. Like they'll say, well, we won't ring the bell or tell you to get up. We'll just let you slide. I just want to mention that Audrey is, I had a comment, there's a comment here from Audrey, who's a Pilates teacher with PD. Boy, do I love Pilates. I take it at least 3 times a week, which I never would have been able to do so much before the pandemic because I take it virtually. I can't say enough about Pilates and adding that into your toolbox. It's a fabulous practice, and I steal from Pilates all the time too. I steal from anything that'll help.
Absolutely. Well, I want to thank you so much for sharing this practice with us today. It was very relaxing. I think a lot of people are very interested in looking into this a little bit more, but we're very, very grateful that you gave us this time today. And hopefully we can bring you back again in the future. But if everybody would love to, I guess, give her the wave of greeting, but today we're going to say namaste to Theresa. So namaste, Theresa, for
Namaste,
sharing
everybody.
your light with us
It
today.
was wonderful to be here. Take care, everyone.
Thank you. Everybody have a great Monday. Now you should be relaxed. Take care and have a good one. Thank you.